Ladies and gentlemen, distinguished guests and esteemed participants, very much welcome to today's panel discussion. Gender equality in health? Question mark, as you may notice. Globally, out of 100, the current score for women's health is 53 out of 100. The highest score is from Taiwan. The lowest score is from Afghanistan. And why it matters is because healthy women are the cornerstones of families, societies, economies, governments, and our globe. The healthier our women, the healthier our globe will be.
Then, 26 years ago, women's health issues and women's health in general was very neglected. And the male was a norm in medical research and medical teaching. When McKinsey, they produced a study in 2022. The study shows that only 1%, listen to this carefully, only 1% of the investments within the medical research and innovation sector goes to women-related research. Can you believe that? Only 1%.
1%? We just heard it. 1%. That means that there is a lot of money and a lot of bias to the rest of the research in medical care. It must be because we are looking at women very differently, basically. We are still seeing all of us like the Virgin Marys, really. I am the vicar here, so I can say that. Out of 100,000 people that go to mammography, 46 of them die in the age group where we have the mammography between 40 to 74. In the age group over 75 to 89, it's 120 women that die. It's more than double, and that goes for region by region by region. It's a fact.
Yes.
And I think that fact speaks for itself.
I am absolutely in agreement, and the colleagues that I've spoken to, that 40 to 74 is extremely important. And then we will additionally be having personalized medicine. We'll be looking more at the genetics, more at the other risk factors. And it's not just the BRCA1 and 2 that's been spoken of concerning the genetic risk factors. We now have almost 200 markers we can be looking at. And so then we might have subgroups that might be looking at even earlier and even later. And I think that would be a way forward.
And we really need to be able to prove that it's worthwhile to put in these screenings, because the screenings are expensive, not because, of course, that one screening is so expensive, but because it concerns so many. So it's a big investment for healthcare. But of course, it doesn't mean it wouldn't be worthwhile, because, of course, it's much more expensive to have people being ill, having to be taken care of much more. So I think we need to talk about this. We need to be very systematic and political about it.
And what we found was that 2 out of 3 treatment studies since 2017 to 2022, so a 5-year period, did not have any type of sex-based analysis. So they did not look at the results separately, which is a huge problem. That means that the studies that we get cannot at all identify differences between how men and women react to drugs or other types of treatments, which means that information can't be disseminated into the medical community. It can't be disseminated into clinical practice.
So we women, we have to get loud, we have to claim our rights. We do that from time to time, but and it came to me as we were talking about menopause, women and women menopause.
There is a treatment in breast cancer. You know that men can also get breast cancer, even though there are very few of them. And when they do, mostly hormonal, they get the same treatment as the women, which puts them into menopause immediately. So my suggestion is to give this to the politicians that are against all these, just to let them know how it is to have these difficulties as a woman.
I would like to thank Alexandra, Eva, Kirsten, Chris, Catherine, Susan and Nora very much for your time, your preparation. I heard your voices loud and clear. Also heard the call for another one of these conversations, and so we're committed to having this conversation annually. We will be back again next year, and I've made a note of all of those topics that we want to add. Awareness, access, affordability are the three words. If you take nothing else away from what I've said today, take those three words and one more, and that's action. We can talk about this a lot. We've been talking about it for 2 years. Now it's time that we take some action out of all of this fantastic debate. Thank you very much.